Pat had a heart problem, and the doctor recommended that she have an implant. And the surgery in and of itself went fine, but the tenderness from that surgery never went away. And she had trouble getting people's attention.
She was pushed back from whatever the medical providers were, whether it was in an inquiry at the customer desk or her post-surgical follow-up with her surgeon. They denied that there was anything wrong and that this was standard operating procedure. This is just how your body will heal.
Nobody thought it was out of normal until she became very ill. Ultimately to the point where it drove her to the emergency room.
And I'll never forget, the night we brought her into the ER in so much pain. And she was explaining to the ER nurse that she had this implant. And he's going, I don't see anything in here about an implant. I don't know. And she's going, are you kidding me? It was just down the hall 4 months ago. This same hospital. And you can't find that in my chart?
And they let her go. And it was a couple days later that they realized that she needed to come back in and that she was experiencing, I believe, what we knew at the time, septic shock.
The implant was just full of infection. When they pulled the wires out of her heart, it actually left infectious debris in her heart, which traveled to her lungs. She was in and out of the ICU 2 or maybe even 3 times in 7 weeks in the hospital.
We had the pulmonology team, the cardiology team, the infectious disease, nephrology. The nephrology team is looking out for her kidneys, but ultimately her heart was what the problem was. How was she gonna survive sepsis with a weak heart? That was never addressed.
I believe there was a lot of confusion. Things were changing so rapidly, and there were so many medical professionals involved. You need to have effective communication between family, patient, and staff. To have a printout of a pulmonologist's perspective or have a printout of what tests were done for Pat today would have been tremendous. Looking back, it's just shocking that she's not with us any longer. I think that's the hardest thing to come to terms with.
I made several attempts in order to obtain medical record. I'm not convinced to this day that I actually have complete medical record. In having others review the record, they were able to confirm that there were many components that were missing. That makes me wonder, what were you treating her for? What were you looking at? I'm not sure. A lot of not sures.
The medical records are vague. All those phone calls, never a part of the medical records. The discussion with the technician, not part of the medical records. The discussion with the nurse practitioner or physician's assistant in the lobby of the surgeon's office, no record.
The reality is, medicine is a practice, and it's something we're practicing every day. And so we have to make sure that when we are practicing medicine, that we're working in the best interest of the client. We also got to make sure that when we're accessing medical care, we just don't rely upon our doctors. We got to look at it from multiple different lenses and multiple different perspectives. We have to ask the hard questions. We have to challenge them.
Her whole life, my mom was a fighter. She never gave up. She overcame many odds. And during her illness, she fought so hard. Her struggle and her fight and her ultimate death can't be for nothing.